Welcome back to the King's Podcast, the Wellness Dive with Lackie. I'm your host, Esther Lackie. Today, we'll be talking about glaucoma. What do you know about it? Who's at risk? What are the treatment options? And can it lead to blindness? Well, today we are joined by Dr. Salman Waqar, consultant ophthalmologist and specialist in glaucoma and cataracts in adults. He's here from Moorfields. King's College Hospital London in Dubai has a collaboration with Moorfields Eye Hospital here in Dubai for eye services. These eye services are provided here at King's Hospital in Dubai Hills. So this is where you can find Dr. Salman under the umbrella of all our specialties. Today he's here to take us on a deep dive into glaucoma in adults, which is one of his specialties. Dr. Salman, thank you so much for finding the time to cross the road from Moorfields and find us here at King's.
Thank you so much. It's a pleasure to be here. Thank you for the invitation.
It's our pleasure to have you here, Doctor. So we'll get straight to the point. Glaucoma, we hear it everywhere, in the movies, people talking. What is it?
Well, quite simply, glaucoma is when you have high pressure in the eye, and that can then start to damage the nerve that connects your eye to the brain. And this can then start to affect our vision in an irreversible way. In the shortest of definitions, that's what glaucoma is.
All right, so you mentioned the pressure in the eye.
Yes.
What causes this pressure?
Think of it as a drainage system. We have a muscle in the eye that makes fluid, and then we have a drainage channel in the eye that drains the fluid away. This is not tears on the surface of the eye. This is all to do inside the eye itself. So when your eye waters, that's got nothing to do with it. That's completely separate. This is an internal mechanism in the eye. And sometimes when the drainage system is not working as well as it should, can be for a variety of reasons, such as you may have inflammation in the eye, secondary to trauma, or simply genetic as well, which is the case in the vast majority of people. Then there's an imbalance. There's fluid being produced, but it's not being drained away. So quite simply, the pressure builds up in the eye, and that can then cause an effect on the nerve in the eye, which can start to damage your vision.
Wow. All right. Sounds very serious.
It can be, yes.
It can be.
The important thing to remember is that any nerve damage in the body, anywhere, including the optic nerve, which is the nerve in the eye that connects your eye to the brain, is irreversible. So when you suffer any nerve damage, whether it's in the eye or any muscle or any part of the body, the nerves can't regenerate. Your muscles can regenerate, other tissues can regenerate, but nerves cannot. So that is why it's very important to diagnose glaucoma early and treat it so that we can prevent damage and loss of vision. Because once it happens, you can't reverse it. You can stabilize it, but you can't bring back the vision that's lost.
All right. But before we get to those topics, are there any risk factors? Who's at risk here?
Well, risk factors include people who've got a family history of glaucoma. If you've got a family history of glaucoma, there's about a 25% chance that we could develop glaucoma. Other risk factors include things like if you're short-sighted, with age, that can be the case as well. And if you've got other conditions such as inflammation in the eye, something known as uveitis, or you've had some serious injury or trauma to the eye, these can all lead to glaucoma as well. By and large, the most common reason is genetic.
Genetics. For once, obesity is not getting blamed for something.
No. Well, fortunately or unfortunately, obesity does not have anything to do with glaucoma. Although if you have a healthy lifestyle, it would tend to help with all conditions, and I'm sure glaucoma would benefit as well.
Wow. All right. One of your specialties is the glaucoma in adults. So does this mean children are also at risk of glaucoma?
That's a great question. Children can also develop glaucoma as well. The commonest thing in children really is children who are born with glaucoma, something known as congenital glaucoma. This is fortunately very rare, so it's not very common. It's a very small percentage of patients with glaucoma coming to the eye clinics are children with glaucoma. Very rarely, again, if children have inflammation in their eye, but sometimes it's, you can get inflammation in the eye in association with arthritis, which children can rarely get as well. Then that can lead to glaucoma as well. If you have a serious injury to the eye, that can lead to glaucoma as well. But fortunately, glaucoma in children is very rare. And in the rare children who do have it, it's usually from birth.
You mentioned that glaucoma can get pretty serious if left untreated. Can this seriousness be blindness? Can somebody go blind as a result of glaucoma?
Absolutely. And that is why we strive so much to create awareness about glaucoma and the need for regular checks, because if glaucoma is left untreated, it can lead to complete blindness, and that blindness cannot be reversed. The vision cannot be brought back. So that's absolutely crucial to treat the condition at the right time before you lead to blindness. Now, fortunately, with good screening programs, with good awareness, the percentage of people ending up blind is very low. And with modern techniques, whether it's with drops or the various other kind of treatment techniques that we have, if you're on the right treatment, if the pressure is controlled, the chance of going blind is very low. But if undetected, yes, it can lead to blindness.
Yeah. All right. So, doctor, you mentioned glaucoma occurs as a result of pressure to the eye.
That's it.
So, what are the other symptoms? How can one know, or rather, realize the need to see you because they think they might have glaucoma?
Absolutely. And this is very, very crucial to understand. So to keep it simple, there are two types of glaucoma. One is what's known as the closed angle glaucoma, and the other is known as an open angle glaucoma. The closed angle glaucoma, not to go into too many technical details, can cause a very sudden rise in pressure. So what we normally say, the pressure of up to 21 millimeters of mercury is what's considered normal. The pressure in this condition can go as high as up to 70, 80 millimeters of mercury within hours. And this is really an emergency. Now, in this sudden acute rise of pressure, the patient would feel severe headaches, nausea, vomiting, the vision will go blurred, the eye will go red, and it's something that they will just not miss. They will be very aware that something is wrong. And usually they'll go to their local emergency department and then see the eye specialist. So this is something that would get picked up very quickly, and this condition has to be treated immediately within hours to protect the vision from blindness. But then there is the other kind of glaucoma, which is the more common kind of glaucoma, which is known as the open angle glaucoma, where the pressure goes up very slowly over many years. So it may be 22 for a few years, then 24, then 26. It never goes very high. But this very gradual, slow rise in pressure is such that you experience no symptoms with it. So it's a very silent condition. That's why glaucoma is also called the silent thief of sight, because it's grumbling away in the background, and you're just not aware if you don't have regular eye checks. And with this condition, with this type of glaucoma, there would be no symptoms until it's too late. So by the time the person begins to feel that there's some impact on their vision, they can't see clearly, already more than 90% of the nerve has been damaged. And it's too late. So that's why regular checks, particularly after the age of 40, annual eye examinations with not just with an optician for glasses, but with an eye specialist, particularly if somebody has a family history of glaucoma, are very, very important. And these are standard protocols around the world, in fact, for screening for glaucoma.
Let's get to diagnosis. How does one get diagnosed? First, let's assume I'm experiencing some of the symptoms you mentioned. Definitely, I'd go to the ER. I won't call you immediately.
Yeah.
So how do I get from the ER to your clinic?
Well, that would be up to obviously the physician in the emergency department. They would, of course, do a full examination to make sure there's no other reason. Let's say you've got an acute attack of high pressure. Of course, if you've got headaches with it, they would want to make sure there's nothing related to the brain or neurological happening. But once they've ascertained that everything else is fine and this is indeed an eye condition that's causing the symptoms, then they would call the ophthalmologist. What we would then do is a full eye examination on a slit lamp, a special microscope that we have in clinic, allows us to look in detail into the structures of the eye, check the pressure. We have special instruments that can help us check the pressure in the eye, and putting it all together, that would confirm the diagnosis for us. Other tests you can have done are something known as an OCT scan, not a CT scan that you have done otherwise. This is a special scan for the eye, which gives us a detailed picture of the nerve in the eye. And also you can have a visual field test as well. So we take all this information and then we diagnose glaucoma.
Okay, and then now that you found that I 100% have glaucoma, what are my options? What are the treatment options?
Yeah, so this is something that has improved a lot over the last 10 to 15 years. It used to be that about 20, 30 years ago, there was only one kind of eye drop you could have and only one kind of surgical procedure. And if those didn't work, that was it. That was the end of the line for the eye. Whereas now we have a whole range of options. So there are 3 or 4 different kinds of eye drops that you can take, very similar to how someone might take blood pressure tablets. And you have to take them for life to keep the pressure under control, either once or twice a day. If the drops are not working, or if you're uncomfortable with the drops, then you can also have some gentle laser treatments to the eye, depending on the type of glaucoma. And if this doesn't work, then in about 10 to 15% of people, we have to move on to surgery. Now, with surgery, there's a lot of different options. You can even have the cataract in your eye removed, which is thickness and cloudiness of the lens in the eye, which can, in certain cases, can cause glaucoma as well. We can also put minimally invasive stents in the eyes or tubes in the eyes known as aqueous shunt devices. All of these are very, very straightforward procedures to do, and they have improved tremendously over the last 10 to 15 years in enhancing their safety profile by leaps and bounds. As I said at the start, if you're on good treatment, the chance of losing vision with glaucoma is very minimal because we have so many treatment options available.
But then that depends on how early you get the treatment.
That is the crucial thing, absolutely. So the most important thing that I want to highlight today is the importance of having regular checks so that A, the diagnosis is made on time, and B, if you are on treatment for it, then please be compliant and very regular with your treatment.
Basically, it cannot be reversed.
It cannot be reversed. Absolutely. At present, there is no technology to regenerate the nerve in the eye. And once that's damaged, it cannot be brought back.
You've treated the patient, rather you've treated me in this matter. How can I manage my lifestyle? How can I manage the condition in the long term? What lifestyle changes do I need to make?
That's a great question. So in terms of lifestyle, often glaucoma patients do ask this, do I need to make any lifestyle or dietary modifications? The short answer to that is, of course, if you have a healthy lifestyle, regular exercise, good balanced diet, it's good for your body overall, but it's also good for your eyes, also in many other ways as well. Because if your body is unhealthy, it can impact your eyes in a lot of different ways. When we talk about glaucoma specifically, there are no modifications that are required. So I often tell my patients, just enjoy your life and carry on as normal. The only thing you must do is use your treatment regularly. If you're being given eye drops, you have to make sure that you put them in every day on time, long term. It's a small inconvenience to protect your vision long term. We usually would recommend 3-monthly or 6-monthly or annual follow-ups. Please make sure you keep your follow-up appointments on time. These are the 2 most important things. Other than that, there are no specific, as happens with many other conditions, where you have to specifically make some modifications, such as restrict your salt intake or other things. With glaucoma, none of that is required.
All right, doctor. Thank you so much.
My pleasure. Thank you for having me on the show.
Time. And next time, I hope to see you again to talk about cataracts.
Absolutely. Looking forward to it.
There you have it, ladies and gentlemen, glaucoma. Like I mentioned at the beginning, Dr. Salman is here at King's to provide eye services. He is visiting from Moorfields Eye Hospital here in Dubai, and a collaboration between King's and Moorfields here in Dubai. Until next time, goodbye.